Move it all over. Focus assessment. Okay. And actually that's what you hear when you listen to the patient lungs. You hear the crackles. And you do know what crackles sounds like, right? And you can imagine that this patient now has crackles all the way up to his neck. So this is an acute emergency, isn't that so? Okay. Now, patients who are going into heart failure, this is very important. If you have a patient in the hospital setting or in rehab nursing home and they're going into heart failure, what do you think the first thing is going to be? When you listen to their heart, what are you going to hear? Is it the rate going to be slow or fast?
Fast.
It's going to be fast.
To
Why do you think it's
to
going to be
compensate.
fast? Yeah, it's going to compensate. So that's the first thing. You have a patient and they didn't go to any kind of physical activity. They have a past medical history of heart failure. And you go in and they're taking their medication. Maybe they're on their beta blocker. And you hear that heart rate was maybe 80. And now it's 110. You want to say to yourself, that's the first sign that this patient is going into heart failure. Now you're going to hear A, you're going to hear an S3 and an S4. And you have to be very, you have to listen very carefully because the patient is also going to develop a third heart sound. So instead of hearing, locked up, you hear like a horse is galloping down and Pompano Raceway. That's how it sounds, like a horse is galloping. And it's very hard at times for you to distinguish. But you should hear that clear, locked up, locked up, locked up. Now you're going to hear a third heart sound that's called S3 or S4. And it's like a horse galloping. So you need to pay further attention when this happens. If you hear this in kids, it's okay. It's normal in kids. But it's not normal in an adult. So in case you're working in the hospital setting and you do hear this, then you need to call the doctor. Because you as the nurse, you must know the signs and symptoms and you must intervene in a timely manner. Call the doctor. Maybe the patient could get a chest x-ray or maybe the doctor could order some Lasix or something for that patient. And again, if the patient is taking the medication, that is one other way for you to know whether or not the patient is taking the meds. Because they're going to be on this medication for life. They're going to get a diuretic, and they're going to be in a beta blocker or an ACE inhibitor. And these are joint core measures that we call them. Joint Commission says that every patient who's admitted to the hospital with certain disease conditions, such as heart failure, they must go home on a beta blocker. Then you must talk to them about smoking cessation and what have you. So now, here is Mr. Federico. We listen to his lungs, and he has difficulty breathing, right? He's full of crackles. Okay, so what are you going to do? First things first, priority is always what? Airway, breathing, circulation. So what's the first thing you're going to get for this patient? Oxygen. So you go ahead, and I put two different oxygen devices on the table. You have your nasal cannula and you have your face mask. Which one do you think the patient will need? The nasal cannula or the face mask? The face mask. Isn't that so? Why is that? Why do you think he's going to need a face mask? Open it, yes. It needs a higher concentration of oxygen, and the face mask is what's going to give it to him. So we're going to put the face mask on.